Intra-oral and facial photograph shooting. Taking the intra-oral and facial photos of the patients is to record a change of tooth alignment, occlusal relationship, and facial morphology in the 3 stages of the orthodontics. These photos are the intuitive data for the diagnosis, treatment skin design, and the evaluation of the therapeutic effect in the process and after the orthodontic treatment. Further, they are also the important materials for scientific research and paper publishing. The consent of patients and their parents should be obtained before shooting, and the informed consent form should be signed. Camera selection. Professional digital camera should be preferable or recommended. Lens of the camera. Fixed focus macro lens will be preferable. Lens of the camera. The macro lens of 90 to 135 is generally applied in orthodontic shooting, which can achieve a comprehensive shooting of intra-oral and facial view. Flash. Generally, orthodontic shooting is macro shot, preferred ring flash. Camera parameter settings. In this video, we take the Canon A0D as example to introduce the camera settings. Set the mode down to M, the manual exposure mode. Aperture value AV and F value in intraoral photograph shooting. The larger the F value is, the smaller the aperture value AV is, but the greater DOF, depth of field, becomes. Adjust F value by pulling the rear thumb wheel. Normally set F value at about 22 for intraoral photograph shooting. Photosensibility ISO value. The greater the ISO value is, the stronger the photosensibility becomes. Press ISO button and pull top down view to set ISO value between 100 to 200 for intraoral photograph shooting. Shutter speed. Pull the top down view and set shutter speed at 1/125 seconds for intraoral photograph shooting. Appurtenance tools. Cheek retractor, labial fork, reflector. Appurtenance tools. There are different sizes of the cheek retractor and reflector, and appropriate auxiliary tools should be selected according to the size of the patient's mouth and the dental arch. Intraoral frontal photograph shooting. Generally, it is used to check the alignment, middle line, and symmetry of upper and lower dentition. Dental assistant selects the appropriate cheek retractor, rotationally seated into the patient's mouth, and pulls the retractor toward the respective ear to fully expose the upper and lower dentition and the oral vestibule. Intraoral frontal photo. Photographer's posture. Stand directly in front of the patient, positioning in the lens at the same plane as the maxillary plane, and be perpendicular to the labial surface of central incisors. Focus on the incisors and keep the maxillary plane consistent with the horizontal midline of the image, and then show the midline of the patient consistent with the vertical midline of the image. Intra-oral lateral view shooting. It is used to check the occlusal relationship between canines and molars. Dental assistant selects the appropriate cheek retractor, rotationally seated into the patient's mouth, and pulls the retractor toward the respective ear, then tilts the patient's head for 90 degrees until presses one ear. Intra-oral lateral view. Photographer's posture. Stand in front of the patient's side, positioning the long axis of lens at the same plane as the maxillary plane and be perpendicular to the buccal segment. Focus the camera on the canine area. Intra-oral lateral view, viewfinder coverage. Appropriate contralateral buccal mucosa should be left in the front. The final molar should be exposed as much as possible in the rear, and part of the retractor image should be shot. Besides, contralateral central incisor should be photographed. Intra-oral occlusal photograph shooting. It is used to observe the shape, symmetry, and crowding of dental arch. The camera captures the occlusal image in the reflector, which needs to be preserved later due to the mirror principle. Intra-oral occlusal maxillary photography shooting. Dental assistant opens the upper lip by labial fork and puts the reflector into the patient's mouth until the second molar could be shot at the very least. Intra-oral occlusal maxillary photograph shooting. Photographer's posture. Stand in front of the patient and focus the long axis of lens on the center of the plate in a 45-degree angle. Blow air gently in the posterior segment of the plate. Besides, focus on the camera on the midpoint of the line between the premolars. Intra-oral occlusal mandibular photograph shooting. Dental assistants open the lower lip by labial fork and push the reflector into the patient's mouth. Then, the plate should be lifted up after setting the reflector into patient's mouth in lingual direction until it touches the maxillary incisors, and the second molar should be shot at the very east. Intra-oral occlusal mandibular photograph shooting. Photographer's posture. Stand in front of the patient and focus the long axis of lens on the center of the plate in a 45-degree angle. Blow air gently in the posterior segment of the plate. Besides, focus the camera on the midpoint of the line between the premolars. Extra-oral frontal photograph shooting. It is used to observe facial proportions, facial symmetry, and lip shape. Extra-oral frontal photograph shooting. The facial photograph requires the lower line to be clavicle and upper line to be had with a little space in an unflattened white or blue background. In addition, the image should be in the center, leaving certain blank space on both upper and lower area of the image and keep it symmetrical to patient's left and right side. Besides, patients should try to avoid wearing dark high-color clothing, remove glasses, type out long hair when necessary. Extra-oral frontal photograph shooting. Patients should expose their forehead and ears and look straight ahead. The pupil line should be parallel with the ground, and the distance between the two sides of lateral canthus should be equal to the hairline. Extra-oral frontal photograph shooting. Photographer's posture. Stand in front of the patient and put the camera upright to keep the long axis of lens parallel with the ground and as high as nasal root. If the patient represents gummy smile, then the lips should be closed tightly for shooting, and a picture of the relaxed lip state should be taken at the same time. Frontal smiling photograph shooting. The posture of the patient and the photographer should be the same with that of taking the extra-oral frontal photo. The patient should smile fully and naturally. Pronounce E when the natural smile is impossible.
Please note that patients with gingival smile should expose gums normally.
Profile photo. It is used to show the lateral morphology, including nasolabial angle, mentolabial groove, and the closer state of upper and lower lips, etc. The patient shall turn 90 degrees to expose auricle. Profile photo. The photographer should stand in front of the patient's side, keeping the long axis of lens parallel with the ground and perpendicular to the patient's sagittal plane, and as high as the tragus area. Shoot vertically and focus on the anterior tragus.